Hi, I'm Sophie Kiwala, MPP for Kingston and the Islands, and I'm here at Street Health today. We're doing another Conversations with Sophie taping, and I'm super excited to be here because, of course, Street Health has been a very integral part of our community, especially with respect to the opioid crisis. But there's so much more to Street Health than just the opioid crisis, just the naloxone kits that we've been reading about. And I'm here with Vi and with Meredith. And Vi and Meredith are going to introduce themselves, but I want to say publicly, thank you so much for your work that you've been doing in the community. I know that you have been in the spotlight. I know that your work is very challenging. And I just want to say thank you so much for that work, and thank you for being on the show. The viewers, I know, are going to be very excited to learn more about what services are offered here at Street Health. So here we are in the needle exchange room, and we were just reminiscing about the your last place of work and the facilities there, and how much better the facilities are here. It wasn't the best where you were, and I'm glad that you're here. And there's a lot of equipment here, and I'm wondering, either Meredith or Vi, if you could tell our audience a little bit about what we're looking at here and what kind of activity goes on in this room.
Sure. So this is where people come to collect equipment for safer injection or safer inhalation. Mm-hmm. So there's a whole load of choices depending on what the person needs. Yeah. And really we consider it a place where we can connect with people who may not be using our primary care or opioid substitution services. And this is an opportunity for us to provide education and support. Mm-hmm. I think part of the importance of the needle exchange is actually connecting with people, helping them to connect with services here too, not just for supplies, but for other things that they may require.
Okay, so typically in this room, your client or patient would come into this room, and you would be one-on-one with a staff person, and you would start that conversation about what's happening in their lives, type of idea?
Yeah, okay. Depending on where, we really just take the lead from the person that's presenting here, and,
right.
And our peers do a ton of the work in the needle exchange as well,
okay.
Which we're really grateful for their expertise.
Yeah, okay. Vi, do you have, can you add to that conversation anything that we have missed? Like, can you talk a little bit about, as a manager, what the numbers are like here? How many people come through here and use this service?
So the needle syringe program is sort of that every door is the right door sort of mentality that Street Health encompasses, right? Is we're not here to, we're not abstinence based, we're harm reduction focused. So when people come into the needle syringe room, it's really an opportunity for them not only to get supplies, but to connect hopefully with someone, either a peer or a staff member, about what they're using, how they're using it. It's really, education is really important, especially in this room, informing people of proper use. All the supplies here are one-time use, like single pack, individually wrapped sterile products. So again, it's really just about reducing harm, but also to inform people, to let them know what the products are for, how they're used. The posters are another sort of reminder, so that people maybe who are not as familiar with the product or are new to the city might not know how the needle syringe program works. And all the supplies are free. People can take as little or as much as they want when they come in here, and that's really important. So whatever they feel they need, we want to make sure they take it, but we want to make sure that they take all the product. So if they are using inhalation equipment, that they've taken everything that they need. So part of the information around is to kind of let people know, hey, make sure you've gotten this, this, and this if you're going to inhale. If you're going to be injecting, make sure you've taken all the proper, meeting sort of best practice recommendations, but also just sometimes people don't know what something is for, so giving them the information, but also having somebody to talk to about it is important. But again, we don't always talk to someone. It's we give them an opportunity to like, we're here,
Right.
and if you feel ready and you want to talk about it, we're here to help you. But if we notice somebody's kind of not looking at stuff and not really sure what to take, a lot of times the peer or the staff member will engage someone. But again, it just depends on how that person, if they're coming in, you can tell they just want to come in, get their stuff and not talk to anybody, then we won't. But if we feel a person's kind of looking around or has some questions, that's what we're here for. So meeting them where they're at, that's the key to our needle syringe program success, I think, too, is we will go to people, we deliver products, we pick up, we have huge amount of outreach that we do with the community, landlords, businesses, the general public call us, the police, the city, especially if there's any loose used products out. We try to do our best to go out and get things as much as we can. But again, it's just meeting people where they're at, so wherever they are in the stages of their use.
Journey.
Yeah.
So we're back after a break. Thank you very much for tuning in. I'm Sophie Kiwala, MPP for Kingston and the Islands, here with Meredith and Violet at Street Health, which is a satellite of Kingston Community Health Centers. Very excited to be here. This is an exam room that we're in right now. And Meredith, maybe you can talk a little bit in the previous part of the taping today, we talked a little bit about the harm reduction piece. So if somebody is willing to have those conversations, they're coming into this room, what's the conversation like, and how do you begin that process in somebody's journey?
So like you said, we wait for people to be ready to engage.
Yep.
And I think part of the benefit of Street Health Center is we do have a lot of access to other resources. So we do provide primary care, which is where we're standing right now in a primary care room.
Okay.
So that's part of the Canadian drug strategy. One of the pillars is treatment. So that we're going to talk about the treatment pillar here. And so we're offering primary care to people. We're offering hepatitis C testing and treatment, counseling. They can access psychiatry services here as well. And then opioid substitution therapy, in addition to other treatments for other drug dependencies like alcohol as well. As you know, the ACEs study is 20 years old this year. It was published first in 1998. And I think it's helpful for all of us to know about the study itself. It really helps us understand the significance of our chronic health conditions, including addiction, including school failures and things like that. And it really talks about adversity that we experience from the age of 0 to 18 and the effects that has on our brain development over time. So it actually makes you vulnerable to developing and maintaining an addiction, along with a whole host of other chronic diseases, and again with the school failure and incarceration rates and things like that. So of course we're deeply interested in adverse childhood experiences here. For the 18 years I've worked here, I have heard very few stories that don't involve a significant amount of trauma. And I think initially drug use is a mechanism to cope with that significant amount of trauma that people experience. It's almost a universal truth that people tell us about here. So it becomes integral to the work that we do. And in terms of our advocacy outside of here, if you can imagine the significance of those adversities that are occurring, it does require cross-sector collaboration to address it. And I think it actually requires us to have a culture and paradigm shift in the way that we view things. So if you know about the adverse childhood experiences and their effects on people, it changes you. It changes the way that you look at addiction specifically, maybe. Some people look at it pejoratively in the past, and I think it changes your perspective from asking what's wrong with you to what's happened to you and what's it like to live where you live.
This has been an incredibly informative session. Generally, this show I have used to focus on social or innovation and research in the community. This is social innovation for me, and I think that our viewers are going to find it extremely interesting. We've all been concerned about the crisis in our communities across the province, and once again, I'm very, very thankful. So thank you for joining in Conversations with Sophie, and I look forward to seeing you the next time.